Have you ever wondered about the first set of teeth, also known as milk teeth? Well, let's talk about them. Milk teeth are a special group of 20 teeth that usually come in pairs. The lower jaw's teeth usually pop up first, followed by the upper jaw's teeth. The first milk teeth usually start showing up around the 6th or 7th month, and the last ones usually appear between the 20th and 30th months. This whole teething process usually lasts from a year and a half to 2 years. But here's the thing, teething can be a bit of a roller coaster. It can be painful and uncomfortable for babies, and it can also be a bit tricky to manage. Sometimes, babies might have a hard time dealing with the discomfort, and this can lead to some not-so-fun symptoms. Now, I know some of you might be worried about teething, and I totally get it. It can be a bit of a challenge, but there are some things you can do to help your baby through it. First of all, make sure your baby is well-nourished and getting enough rest. Also, try to keep your baby's gums clean and dry. You can also give your baby some cold, wet foods to soothe their gums. If your baby is having a tough time with teething, don't hesitate to reach out to your pediatrician for help. They can give you some additional tips and advice on how to manage your baby's discomfort. So, there you have it, a little bit about milk teeth and some tips on how to help your baby through teething. Remember, every baby is different, so it's important to be flexible and adapt your approach as needed. The baby's care is pretty simple and usually doesn't need any medical help. Getting some fresh air and regular exercise is important. To keep the bowels regular and relaxed, you can use castor oil. You can also give the baby cold sponges and rub their body dry with a rough flannel cloth. Breastfeeding should be frequent but not too long to help the baby stay hydrated, keep their gums moist, and soothe any irritation without overloading their stomach. The mom should also take care of herself and eat healthy foods, avoiding anything that might be too stimulating. From the time the baby's teeth start to come in, they can find some relief from the pressure on their gums by numbing the sensation and dulling the pain. People often use things like coral, orris root, or scraped licorice root to do this. The nurse can also gently rub the baby's gums with their finger, and this seems to help soothe the irritation. In France, it's common to dip licorice root and other things in honey or powdered sugar candy. In Germany, babies are given small bags with a mix of sugar and spices to suck on when they're teething and feeling grumpy or upset. While these things can help for a while, they can be bad for the baby's stomach and make them less appealing in the long run. And of course, as always, follow us for more tips in all things dental.